In today's Eye on Health, another positive step out of the pandemic, Allegheny Health Network is updating its visitation policy for its hospitals. Effective immediately, patients are allowed to have one healthy support person with them during visitation hours. There are some exceptions and guidelines, and it has to be the same designated person for the entire stay, and that person must wear a mask at all times, but certainly some good news there.
Absolutely good news. And something else AHN wants you to know, it is okay to come to the emergency room. Now, this has become an issue.
Yeah.
Doctors fear people are neglecting their health out of fear and ignoring symptoms that could be signs of something very serious.
Dr. Thomas Campbell is chair of emergency medicine for Allegheny Health Network and says it is safe to get help. Doctor, it has been an unprecedented time in healthcare with the emergence of COVID-19. So what impact have you seen on the emergency departments?
Well, thanks, and good morning, everyone. Our first focus was on safety, protecting our patients, our visitors, staff from COVID-19 transmission. We had to get good information as we were learning about the virus and get it out to the public on how to protect themselves, and try to ensure adequate PPE, personal protective equipment for our staff and ourselves, and then isolate patients who had symptoms. I think some of you have seen tents and trailers beside our emergency department, and that was to be prepared if we had a surge of patients with similar symptoms as we saw in bigger cities. We could isolate them and separate them out into areas before we brought them into the hospital if we were capable of doing that.
And doctor, I think as people listen to the news and they hear more about this, sometimes you can get very afraid. And there are people who have been afraid to go to the emergency room. What are you guys seeing? I mean, sometimes these are serious cases and they're not getting the help they need, right?
Right. As an unintended result, fewer patients were using the emergency department. In fact, a CDC study last week showed that across the nation during April and May, 45% fewer people visited the emergency department, and that was true within Allegheny Health Network as well. And our fear is that people who really needed our care did not come in with problems such as chest pain, shortness of breath, and signs of a stroke. We really want to get the message out that we're doing everything we can to make the emergency department safe, and you shouldn't stay home when you have signs and symptoms that I just mentioned.
And Doctor, I had even heard from other healthcare professionals about people who had broken bones who were not going to the ER. Do you think this is out of a fear on a couple different levels, but perhaps before knowing that you may be alone? Sometimes the doctor's office or the emergency room can be a scary place.
Oh, absolutely. It can be fearful, but we tried, even when we had no visitation, to update families. We had family members who just stayed in the car, and we were able to do video visits with the family to let them know how things were going, to stay in touch with their loved one, because it is a very scary time when you have to use the emergency department. And now that we're allowing one companion, I think that will also help alleviate some of the fears.
Yeah.
You know, doctor, for a while, hospital systems were discouraging people from coming to the hospital. How do you determine when it's okay for them to come back? I mean, you guys at AHN have these steps in place. That's got to be part of it, right?
Oh, absolutely. I mean, we've been doing a lot. We have what I call a pivot nurse, but a screening nurse at every emergency department that's greeting people on arrival, making sure they have a mask on, they're checking for signs and symptoms. And then we have a whole host of things we're doing to keep everyone safe. And that's, now that we know more about the virus, we have appropriate PPE to protect our workers. We have round-the-clock disinfecting going on. We have special rooms with negative pressure so that the airflow is not allowed to go into the rest of the emergency departments when we suspect COVID. We have our chairs separated for waiting rooms, and we're keeping our social isolation. And the things we've been doing to follow is certainly the CDC, WHO, and then work closely with, more local, with Allegheny County Health Department and the Pennsylvania Department of Health to help determine that it is safe. And We've added things that we're tracking not only within our hospital but within our health system and then across the region. The number of ICU beds that are available, the amount of personal protective equipment, and also the number of testing capabilities we all have. And those things all go into determining how safe it is to tell people you can come back and we can have a visitor. And we're fortunate in this region that we're at that stage.
Dr. Campbell, thank you so much for your attention to detail with all of that and for keeping us as safe as possible. We really appreciate it.
It's an important message. And remember to keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, and it's brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.